Hello, everybody. My name is Natalie Zamora here with the Daily Camera, and today I will be interviewing a panel of public health experts and co-founders of CaliCollegeCare, a nonprofit helping empower female college students across California to gain STD healthcare and resources. They are here to discuss Senate Bill 306 and its possible impacts in access to testing for sexually transmitted diseases, otherwise known as STDs. This bill is a new California law that requires private insurance to cover at-home testing for STDs. California is the first state in the United States to pass a bill like this. Say hello to the co-founders of CaliCollegeCare, Valeria, Emma, and Madeline. First, we're going to hear from Madeline, who actually took part in drafting this new bill. I would like to know, what exactly does the Senate Bill 306 on sexually transmitted testing entail for California students?
All right, first of all, thank you so much for having us. In answering your question, the Senate Bill 306 aims to reduce stigma and increase accessibility to STD testing. In doing so, insurance will now cover FDA-approved and at-home testing for STDs such as HIV, gonorrhea, chlamydia, and syphilis.
And who exactly will have access to these at-home tests?
Good question. So initially, not all insurance companies will cover the cost of these tests, but this doesn't mean that they will never. The coverage will start with private insurances and eventually ease into public insurances such as Medicare and Medicaid. So most insurance companies will end up covering the costs of these at-home tests.
Thank you, Madeline, for that insightful introduction. Now we're going to hear from the past director of the Student Health Center at California Polytechnic University, San Luis Obispo, Valeria. Can you please discuss why should students push for the bill to be practiced?
Yeah, so as Madeline had mentioned, Senate Bill 306 is a fairly recent addition to the California legislature and is very much still in its newborn stages. Its creation was highly influenced by the increase in the prevalence of STDs and the decrease in testing rates due to the pandemic. The COVID-19 pandemic has made access to testing services a little more difficult because of the stay-at-home order. And I think that shines well within the data that we have that states that there has been an increase in the prevalence of STDs. However, this policy really aims at providing an alternative method to testing during the pandemic. So students should truly push for the bill since it would promote access to at-home testing.
And can you talk a little bit about the procedures for processing these at-home tests?
Sure. So since there are a variety of STDs, there are also many forms of testing along with their respective test procedures. Some tests can be sent to labs for processing after the sample has been collected at home, while others will give you the results there at home. Since, for example, HIV does have some at-home tests that will give results within minutes in the comfort of one's own home. So each test at home has been proven to be safe and effective. All of these tests, at-home tests, have been proven to be safe and effective because they are approved by the FDA before they're even put out on the market and approved by insurances. Plus, getting tests early helps prevent serious illnesses and spread.
Thank you, Valeria, for sharing the relevance and procedures of this bill. We'll now talk to Emma, a researcher within the Centers for Disease Control and Prevention in the Division of STD Prevention, to learn more about the accuracy of these tests as well as their impact on STD rates and treatment. Emma, how will these tests be as accurate as tests performed in healthcare settings?
Well, research suggests that these at-home tests are quite accurate. One study found that specifically those for chlamydia and gonorrhea have over a 90% accuracy for both male and female samples. There was very little difference found between the quality of at-home tests versus physician-administered tests. In addition, as was previously mentioned, these tests have all been monitored and approved by the FDA and are considered safe for general use.
And as a last question, now that there are treatments for many STDs, does it prompt increased unprotected sexual practices?
So there's absolutely no evidence that increased treatments for STD will lead to an increase in unprotected sexual practices and therefore an increase in the rate of STDs. On the flip side, Increased testing options can only be beneficial as they increase access to testing. This is important for STDs such as HIV or HPV, which when left untreated can progress to AIDS or cervical cancer. Early detection is key and treatment options are expanded. Furthermore, increased access to testing reduces the spread of transmission of STDs, which can lower the rates.
And that was all my questions for today. Thank you to the co-founders of CaliCollegeCare, Valeria, Emma, and Madeline, for taking the time to have a discussion on Senate Bill 306 and its importance. I'm Natalie Zamora, and I will see you next time.